I'm Kelly Lemon.
And I'm Michael Paul Williams.
And welcome to the After the Monuments podcast, where we look at events and news about race in a historical context and see how, too often, history repeats itself.
It's our pleasure to have award-winning Times-Dispatch reporter Sabrina Moreno with us today. Welcome.
Thank you so much for having me. I'm so excited.
Sabrina has just done a deep dive into COVID's impact on Virginia's Latino community. And we've been talking about the disproportionate impact that this virus has had on communities of color. And it's been horrific in this community. And Sabrina has given us the hows and the whys and all of that about how that came to happen, the perfect storm of events that led to this disproportionate toll of sickness and death. Why don't you just tell us just what were the factors, historical and current day, that led to this horrible situation among Virginia's Latinos?
Yeah, and I feel like there's not one specific answer because it's such a cannonball of things. And I looked at specifically 2000 to 2020. It was interesting hearing from VDH officials what an impact, 9/11 and also the financial crisis had. And then also hear from immigrants who have been, either stateside or in Richmond for the past 20 years that just talk about the discrimination post 9/11. And that's not in story one, but I think so much of that informed how this has just been going on for so long, and that and how immigration law being strengthened to the point that it has been, and just the role that can play in health. That was
and anti-immigration rhetoric.
Yeah, and I think it was extremely interesting just hearing from public health officials acknowledge the census count. I did not think of that beautifully by myself. It was a lot of people mentioning, being undercounted and that, being tied to government workers and that fear. And Shantony Jackson, who's a community health worker who was at Southwood, she mentioned that even if I were to show up, with the census worker, I knew that they trusted me. They'd still be like, okay, that's La Migra, like that's ICE, and that connection. And so it was interesting to hear how over the years, these policies that maybe you initially don't think have anything to do with health or, the health of someone, how inextricably tied that is. And then you kind of fall into, what jobs are available, what jobs are available that are offering any sort of health insurance. And the reality is that it's not. And so seeing that pattern and just that buildup of, you have these overlapping massive crises that are happening. Then you have the role that work plays, and then work influences your, it's kind of like education influences work influences your income, which influences where you live, and then you just cannonball. And something that I'll be talking about a little bit more in the upcoming stories is just how aware they are about how and I mean Southwood and folks in Southwood, how they're very aware of the segregation aspect of it, and being isolated to this neighborhood that is kind of cut off from a lot of health services, a lot of like access to groceries and things like that, and then not having transportation and the bus lines, to the grocery store, it takes 3 hours, and sometimes so all of these things that you don't think about. They just all come together, and seeing it documented, and maybe not explicitly saying, this is going to lead to this, but just so many public documents just saying like, this is a risk. And seeing that there are people that those reports were reported to. And it just becomes this massive web of people who know all of these links.
For those that haven't read the article, that don't live in Richmond, Southwood is the largest Latino community within Richmond or Central Virginia. How vast?
So in Richmond, it's the largest concentration of Latinos in the city. And it's a predominantly working class immigrant neighborhood. Once you get into Chesterfield, along Route 1, that has a pretty high concentration of Latinos. But in the region, it also had one of the highest just increases, like in the past 10 years, in the past 20 years. And so, and that's also just where, when you look at maps from local health districts that have just put out this data, it's this overlap of really high COVID case counts and just throughout the pandemic. And it's just concentrated in its census tract. And Southwood census tract is almost 50% Hispanic. And that's the largest of any place in the city. So.
And so what we have, kind of the subtext here, is we have an exploding population in Virginia that isn't that's invisible. It seems, when it comes to investment in state policy and not acknowledged in a way that put the state in a position to provide proper services, healthcare services.
Yeah, and I think all of these other policies that go into that. It's the first Latina that was in the General Assembly, was Delegate Guzman, Hala Ayala, which, that was 2017, 2018. So that wasn't that long ago. And
so a lack of political representation.
Yeah. And I think that cannonballs into so much more, because if you look, like Delegate Guzman has proposed paid sick leave bills. Delegate Tran has proposed language access bills. And I think something that is worth noting is that this has been a bipartisan effort, right? I mean, this is spanning, and this is just from what I looked into, spanning about 5-6, administrations, governors, and like points in which it was predominantly Republican. And then we also had this period during the pandemic where it was predominantly Democrats. Both sides were shutting it down. So I think that's also been interesting to just see, because I think sometimes it's easy to be like, oh, Republicans are the ones that are, anti-public health measures and Democrats are pro-immigrant. But to hear Southwood residents, they just lump them all. Like it's just like they see what they're not doing. And I think that's something I loved that I found through this project, because I think it's very easy to think of, working class immigrants as if they're not empowered, as if they don't know what's happening. And it goes back to just that stereotype that, we're stupid, we're quote unquote illegal, and all of these stereotypes, which many in Southwood are very aware of. And it's just the complete opposite. And I think, and I wish I could just like post all the interviews from them. And
so where does that leave? You've been neglected. The state has failed to treat you as it should its resident. Where does that leave them emotionally? When you did your interviews, how did you find their emotional state? Was there anger? What did you sense just doing your interviews and talking to that community?
Yeah, and I do want to preface with that. This is even the people who I spoke to, which was about 10 to 15 Southwood residents specifically for this, and some overlapped with a piece I did on housing within that neighborhood. So that's a small chunk, but it's about 1,300 units, and that's thousands of families. But from what I have seen, they kind of, the way that they say it is like, and a lot of local community organizations have mentioned this too, where they're like, I can only see my bubble right now because that's where I live and that's like my existence. And I think they're not, I'm trying to think back on this. It's really, I've seen more people be empowered in these past few months, which has been really incredible. And, I spoke, I just came from Southwood and I asked one of the residents, politicians are likely going to be reading these stories. Like, what would you want to tell them? And instinctively, she was just like that a better world is possible and we deserve to see it. And she said, maybe one or three of us, maybe they'll overlook us, but they can't ignore all of us. And I remember just being like, yes, because that's been really cool to see a lot of Southwood residents feel empowered to say that. But I think there's a lot of grief. I think there's a lot of this feeling of like everyone has kind of moved on, but how do you move on? Well, also just having to, right? Like you have to keep working. You have to keep, figuring out your rent so you don't get evicted. You're figuring out just so many things to just keep you alive and to just keep going. And I think a lot of them mentioned over the past 2 years of speaking to them is just that, like, if you stop to think about it, then it's, like they can't kind of thing.
In just reading your piece, one thing that kind of struck me as a chilling kind of precursor was how H1N1 had this disproportionately heavy toll on Black and Latino people in Virginia. But what was learned from that? I mean, how did the state react, if at all? I mean, it's like there was this warning that occurred years before that was not heeded. Why didn't that happen?
I wish I had a better answer. I really do, because and something that I did want to say that I hope comes across in this series and hopefully more in the next 2 parts is, there were so many workers within VDH trying. And I don't want the series to come across as if no one was ever doing anything, because I spoke to so many people who were trying for years, and I think through the budget request, I felt like that was one way of capturing it. Just the constant being like, if we do not get this funding, we're going to lose core public health services. We're going to not be able to, do these screenings for new refugees and just the breadth of things that BDH is responsible for, like federally required programs that they have to provide. A lot of that happens behind the scenes, and that's like a common saying, apparently among public health is that, I'm going to butcher it, but it's essentially like when they're doing the work behind the scenes, that there's not this crisis. It's like, no one's really thinking about public health. And so they're not thinking about how to help them in those times of there not being a crisis. But then a crisis hits, and then all of a sudden, like, the health department has to fix it. And
where's the preventative work that could happen in those gaps when there isn't a crisis, I guess, is the obvious question.
And the public health historian from Columbia who I spoke to really brought it home, because I felt like a lot of interviews were saying this, and I didn't piece it together until he said it. But he essentially was like, prevention is not, a sexy thing for a legislator to be telling their constituents that they're putting their taxpayer dollars for, right? Like, it's like you're preventing something that you don't even know if it's going to exist. But then it goes back to that, how often do we really talk about public health and what public health is, right? And so, and how are we expecting our legislators to just know what public health is and then to fight for public health when it's this thing that can be very invisible unless you're intentionally looking at it and intentionally in it.
But it's also just in America, in the United States, an inherently inequitable system on so many levels that it's destined to produce unequal outcomes, right?
And to also just think that there's going to be no crisis whatsoever. That's
anti-historical. That's ahistorical. Yeah. That's never happened. I mean, you can't count on that. Right.
And there's also been like a really common sentiment, in my interviews with folks within VDH, where a lot of them had just fear of like, what happens when we're, not front page news anymore? Like, will people just stop caring about public health? And I don't think I'm out of bounds saying this. I feel like I heard so much pain in a lot of these interviews. And I think that's a side that, like, we don't see, because even now that they're front page news, so many of the workers who are doing this work are behind the scenes. And you know, that like I had folks talk to me about, you know, it's like you're putting in these like 100+ hour work weeks. You're trying so hard. You're doing everything that you can. And then every single morning you just wake up and the death toll is higher and higher and higher. And, you know, and I'm thinking of, you know, Amy Popovich right now, who is currently the nurse manager for Richmond and Henrico's health districts. And, you know, she was there back in 2009. And, you know, her along with Dr. Avula and Margot Webb, and, you know, they really push these resource centers in public housing. And there's this story that she told me that I think of like all the time. You know, there's this housing advocate in Richmond, Marilyn Olds, and, you know, so Amy showed up and told her what she wanted to do. And Marilyn Olds essentially was like, I'm not going to let you in here unless you can promise me that you're going to be here at least 3 years, at least 5 years. And Amy was telling me, you know, I instinctively said yes. There was no funding for it. There was no guarantee that there would be funding for it. And she fought so hard for that. And I think that's also the thing that's really tough that you don't see. And it's like fighting for funding, and especially for something that deals with racism, and especially in 2009, 2010, talking about how racism is a public health threat. It's not popular among funders. And, you know, and speaking to folks from who did research on Latino communities in the late 2000s, they were just like, no one wanted to fund this. And so I think that's the behind the scenes tension that is really unfortunate.
But it's interesting to hear you frame it that way.
Real quick, After the Monuments is proud to thank Team Henry Enterprises for their support of our show. Team Henry Enterprises is a Black-owned contracting firm specializing in office, retail, medical, multifamily, and higher education construction of all scopes and sizes. In the wake of the George Floyd protest, Team Henry is the very firm contracted by the City of Richmond to take down the Confederate monuments in Richmond and by many other municipalities to remove other Confederate monuments around Virginia and throughout the Southeast. Learn more about Team Henry and how they can help your community rebuild, renovate, or design at teamhenryent.com.
This topic today is resistance to public health. And I've been thinking of it because of the news in terms of people screaming about the vaccine and truckers driving around the Beltway protesting and a Florida governor shaming college students into taking off their masks and just all of that sort of resistance. But you know, just hearing you frame it that way, there's resistance on the policy level. There's resistance on the funding level. There's resistance on the political level among people who could make decisions to provide sustenance for public health. So,
and it kind of goes back to your point of, but there's not enough people that look like the people that need to be served to understand to make those changes.
Yeah. And you yes, and you also touched on something where I just lost it. It's because it's that. Could you repeat what you had said? You were talking about how, yes, it's representation, and it's also the fact that these policies, when we're talking about them, it's oftentimes mentioned who would be among the most benefited. And when you say that
the
paid
kiss
leave,
of death.
right? Like, I mean, I think the best way to frame this, one of the fascinating comments that I've received over the past few days in response to this project was that they would have absolutely loved it if I hadn't just made it about race or ethnicity, if I hadn't made it about Latinos. And it's like VDH being underfunded is going to impact everyone. And that is very true. But that was interesting how they framed it. I would have loved this if you had just not talked about race or ethnicity.
And we're talking about your story in general.
And my stories. Okay. And I think that goes to highlight how like so many of these topics that we're talking about, you know, when we're talking about access to healthcare, when we're talking about paid leave, like that is going to impact Black and Latino people. That's going to impact disabled people, immunocompromised people.
People will cut their nose off to spite their face if they think it's a policy that will benefit people of color or the poor or whatever. And we're talking about health. This is the sickness. This is the sickness of America, that people who would benefit from these policies reject them because they feel like someone else who doesn't look like them will benefit. That's it. It's utterly destructive, and it helps contribute to the situation, morass we're in right now.
And maybe this part will be cut, but I also really
I hope not. I hope not. Yeah, I hope not.
But see, as you were speaking, I immediately think of a parallel that we're seeing right now. I've been told a lot over the past 2 years, change doesn't happen overnight, policy is slow. But then we've seen a bipartisan federal shift to welcome Ukrainian refugees and open up all of our resources, including healthcare. And I cannot remember a time that has happened elsewhere. Even when we're talking about...
Did that happen with the Syrians?
Even when we're talking about Afghanistan, like it's just like there's a really big lack of language access in that realm. And so so it's like we've seen like a massive federal shift in the span of weeks. And so I really just refuse to believe that there's not a better world that exists out there, and I
it comes down to relatability. Yeah. Does it not?
And how do you do that when they don't look like you?
Empathy and relatability are, I think they're very much related. And people feel things when they feel a level of horror when they see Ukrainians being bombed that they did not feel, perhaps because the microphone wasn't as loud and the cameras weren't there when, say, Syrians are bombed or people in Afghanistan are bombed, or you could name any spot on the planet.
Yeah, Venezuelans have been deported back to Colombia to the so it's. Yeah. I'm
gonna bring a little bit of positivity in here, just a little bit.
Why would you want to do that?
I know, just because I gotta shake the table. You talked about empowerment, though, and even I think you stated it too in a previous article, just that the Latino community took control. They made sure that they were providing the resources to themselves. It was almost like they protected the village and was like, okay, they're not going to help us, so we have to figure out how to help ourselves. Can you talk a little bit about that at all?
Yeah, I really love this question because I think, and something I think about a lot, when we talk about issues facing communities, it's very easy to slip into that community being defined by their trauma or what happened to them. And I've been called like an advocate before for this, but I'm like, I literally just saw it. Like it honestly was really beautiful. Like I saw, people in Southwood, their apartment Wi-Fi got so finicky that their kid couldn't, do their virtual learning. And so then people were inviting, those kids to do that virtual learning in their house because their Wi-Fi was fine. When someone lost their job, they'd be bringing over trays of food. And it wasn't like people asked. Yeah. And I think that, and I always say that a really big reason that I wanted to cover Latino communities is like, I grew up in Miami. It's a 50 to 80% chance that you run into a Latino wherever you go. And I've seen that, and I've seen that community of care that is just like that. That's just how we are. And I saw that play out in the pandemic. And does that mean that every single person in Southwood was like that? No, but is any single person in every single neighborhood the same way? And but they're still building on that, and they're still and I think Elena Camacho and Claudia Arevalo, with New Virginia Majority, were huge in this. Xiomara and Shantini Jackson, Xiomara Vidal at the Southwood Clinic, which is part of VDH. I've heard endless conversations of how they talk to folks there, and none of it is this, I'm coming in to save you, I'm coming in to help you. It's all, you have all the resources. You have love here. It's so much from an empowerment lens. I've seen it with kids. They're badasses. I think, I think there's also been such an incredible network of community organizations and, places that rose up because, which I think is a positive, when a lot of philanthropic organizations, when the disparities became so in your face that you could not look away, there was a lot of philanthropic organizations that kind of shifted and then, gave money to places like Waymakers Foundation, Casa La Salud, which are two local, Latino-led community organizations that really, were all about, we can combat misinformation by bringing information to people. They had vaccine clinics. Everyone speaks Spanish, and it feels very, very intentional. Like you would go to a vaccine clinic at Casa de la Salud, there'd be diapers there. They'd be grocery bags, because they were talking about what they needed and they were meeting people where they are. That couldn't have happened with additional funding. And community organizations really rallied around Latino communities. The issue is just that, they can't do everything, and that's the reality. The positive and negative.
Your work right now, it's you can find it right now at richmond.com. However, this is a series that you're writing. What should we expect in these next ones, if you can share anything?
Oh, I'm happy to.
Okay.
So the way that I had set it up in my head was like past, present, and future. The reason that the first story, which is technically the past, mentions the pandemic is because my editor and I both realized, oh my gosh, the pandemic is also in the past. Like we've lived 2 years of it, which is why it includes that. But then story 2 is the pandemic response. And the goal is to just capture just the loss. And so you're going to meet, this incredible woman. Her name is Maria Fuentes. And, she lost her husband in the first few months of the pandemic. And just it feels like two realities, and it's about to be 2 years. And, and she sometimes feels like she's in this limbo of like, people are moving on, but like, I still see that empty seat at my dinner table. That classic saying, it has been, she's invited us into her home, and I literally saw that, like literally saw her eating breakfast, and she was by herself, and 2 years ago she wouldn't have been. And, here we are. And so I think that it's just capturing the loss, but also just the dysfunction and the delays, that led to all of it, and I hope to also just really show that, did the Virginia Department of Health have its faults? Yes. But I mean, I think these are also other interviews that I really wish people could hear, where they're just talking about, dealing with, test results were coming in. They were going through fax machines. They were paper-based. Like they were manually counting them. Like they didn't have an electronic health record system after almost a decade of putting in budget requests for them. Like actually in the 2020 General Assembly session, they put in a budget request for an electronic health record system, saying that they did not have the capacity to be, pulling in so much data, so much patient data. And it did not go through. Like, and so I think it's
nothing says archaic like the term fax.
Yeah.
And imagine just manually counting them. Not every local health district had broadband access. Not every building had Wi-Fi. And that's the other issue with VDH and a lot of public health departments across the country. They all operate differently, but the Virginia Department of Health has a central office and then 35 health districts. And when we're talking about addressing disparities, it looks very different across every single health district, and addressing that can be challenging, especially when every health district is not starting off the same.
I just don't know. I mean, the governor right now is talking about giving the surplus back to the people. I think that's going to be like maybe an editorial today for all I know. How can we talk about giving with all these needs? I mean, if the health department needs all this investment, do we have the luxury to be giving any money back when there are all these just expansive needs to address a crisis and to prevent it from happening again in the future.
And I think that's what's also challenging is that there are people who do not think that we're in a crisis right now. You know, and that's been really
need a media.
A lot of the amount of, now it's something that I just mute in my inbox, but like I still get COVID as a hoax. I constantly get told that I'm manipulating data, that the Virginia Department of Health is making this up, and I've heard that for the past 2 years consistently. It's ramping back up again, and I think that's the thing. Is just people. There really are people who don't think that we're in a crisis, and I
wanted to get into that. Since our topic at hand, how is the rampant politics of it all just kind of played into this sort of dysfunction that's hurting? It creates situations like this.
The undermining of public health officials, you know, and I'm speaking as someone who saw this from the outside and just talking with workers within VDH, and also speaking to, data experts at the University of Virginia's Biocomplexity Institute, which helped advise the Virginia Department of Health. These are people who've been doing infectious disease modeling and are literal scientists. Have been doing this for 20 plus years. And that was also a very grueling interview because the amount of times that they were just like, man, I just hope that they believe us. I just hope that they listen. I just hope that because they've spent 2 years being told that they're lying, that they're frauds. And speaking of H1N1, something that Senator Tim Kaine said, he's a state senator here in Virginia, state senator of Virginia. He said that a really big shift of what he noticed, he was governor of Virginia at the time during H1N1. He said the politicization that we're seeing now, he did not experience. He when he was governor during H1N1, he was like, Sabrina, I was on the phone with Republican legislators, Republican governors all the time. There was not a single person doubting science, and did it look differently than what we're experiencing now? Yes. But, speaking to public health historians being like the way that we are seeing this just massive undermining of public health officials and scientists and public health experts, is something that has not been seen to this magnitude in our lifetimes. And so before our lifetimes, it probably was fine for someone to just do something that is very illegal now to someone who's in public health. So when we're comparing those two things, I feel like they're not very comparable. But yeah, and it's, I don't have a great answer on how we convince folks. And I think I've definitely found that the second that we do mention race or ethnicity, when we mention disability, when we mention, people who have been among the most vulnerable, I still get my inbox being filled with people being like, well, they deserve it. It's their fault. And the reality is that the people who are in power are often not the folks who are being the most affected by this pandemic.
And that's where we end, right there, because that is the point to which this podcast is about. It is about how we are still dealing with this and how we will continue to deal with this as we move forward if things don't change. Sabrina, thank you.
Thank you so much
for coming on this
Sabrina.
podcast. Do not forget to check out Michael Paul and Sabrina's work as you subscribe to Richmond.com. This is After the Monuments, a real talk about race with Michael Paul Williams and Kelli Lemon.
After the Monuments is a Virginia Video Network production and produced by Matt Pachilli, Michael Paul Williams, and me, Kelli Lemon. Technical direction and editing from Bill Barksdale. Executive production from Paul Farrell, Diane Salvatore, and Paige Mudd. Will Royer provides studio support. Our artwork is by Krishna Mathis. I'm Kelli Lemon, and we'll see you next week on After the Monuments.